When I think of AI, I think of the future is now.
When I think of AI, I think about augmentation of human intelligence.
So when I think of AI, I think of it as information expander.
AI will not replace radiologists, but radiologists who use AI will certainly replace radiologists that do not use AI.
Technology working with doctor, working with patient is going to be a game changer.
I think of the most disruptive technology of this century.
In the United States, the cost of healthcare is one of the highest in the world, and that can't persist forever. There's going to be a time where we have to deliver very high quality at a lower cost.
We must solve this problem because we can't sustain as a society by just coming up with quick fixes.
We're in one of the most exciting times in the long history of AI because there's more compute power, there are tons of data available to people around the world, and we're giving off data about our health constantly as we walk through life.
If you can take that information and make it meaningful at the bedside, now you have a much more intelligent, actionable, efficient way of treating patients.
Hospitals have lots of data but are not always great at figuring out what to do with all of that information.
And I think there's such a challenge for healthcare professionals and organizations to really make that useful data, something that can lead towards activating a patient, something that can lead towards better outcomes and implementation. So I think that AI will help us get there a lot faster.
At our hospital and many hospitals I talk to, we're only just now understanding the data that we already have. And just by simply putting that data together in a more meaningful way, we can help the physicians and patients learn about their disease. It's just like opening our eyes for the first time to all this information.
When I started off doing radiology, maybe I would look at a patient's study that had a couple hundred images. Now routinely it's several thousand images.
When I think of AI, I think of an assistant that's behind me that can help to get me what I need where I need it so that I can have the greatest impact in the world.
So some of the things we're thinking about is how can we use tools like AI to help to reduce the physician burnout and bring that face-to-face clinician-patient interaction back to the forefront.
What I want to do is not spend so much time in front of the computer measuring X's and O's, but actually discussing the results with the referring clinicians. How do these numbers impact how you're going to manage your patient? Right? That's really where the value add is freeing me up to say, okay, now we have this quantitative information, what's the context?
The computer plus the clinician is greater than the clinician alone. And I think that's really the potential for AI now and moving forward.
And so it's not about replacing anyone. I think it's about really supporting and really expanding our ability to solve problems, but in a meaningful way.
When I think of AI, I think of the ability to find insights in very complex data sets.
So when you do medical imaging, there's a lot of information that comes into play. It's not just the picture you see, it's also information such as how fast do things appear on the image, if there are changes in the image during the course of the scan. But if you had a supercomputer or AI, and it can see it. It can tell you that information that we just can't see as humans.
And having an automated solution in the background that would kind of let us know which cases we should be reading because there's a risk of a bleed or risk of stroke, that kind of stuff is tremendously important because each minute can make a huge difference.
And then you have areas like population health management, which is coming up strongly, which is really about triaging patients at risk and giving them the best possible care pathway.
One of the interesting places that we're seeing it with our large customers and some of our larger IDNs is around patient engagement tools. So they're looking to AI to help them to identify some of their patients, engage their patients, and then activating them into wellness. And I think that's a really fascinating area.
How can we help them using symptom checkers or chatbots to help understand their symptoms better? How can they sort of understand their own care? So we think AI has opportunities across problems for patients, providers, and sort of other folks all across the hospital.
Whether we're using AI as one of our clinicians used it to develop a model by which they could diagnose cancer, or whether it's being used to help create decision support tools to make it easier for our clinicians to hone in on the proper diagnosis, we need tools like AI to allow us to be better at the things that we are excellent at.